Thank you for taking a moment to watch the video. Really, the purpose of the video is to introduce you to me. You don't know me, so I thought, what a perfect way to have an introduction. I'll tell you a little bit about my background, how I got into health insurance sales, and why I love it so much. I grew up in Ontario, Canada. I come from a family of 4 girls. I went to university to become a dietitian. I love to cook. I had been cooking since I was about 10 years old, so I thought, what a perfect field for me to go into. My first position was with a large metropolitan hospital in Toronto, and I would work with patients who were diagnosed with certain conditions, and that meant they had to change their diets. So a large part of what I did was education. After several years, I went back to university and got my master's. And when I graduated from that program, I ended up working with Eli Lilly, a large pharmaceutical company just outside of Toronto. My role was as a pharmaceutical sales rep. Eli Lilly was coming out with a new antidepressant, Prozac, which means I'm dating myself. But at that time, it was going to revolutionize the treatment of depression. That meant I had to get out, introduce myself to psychiatrists, and educate them on this new drug, how it worked, and how it could potentially help their clients. After several years of doing this, my husband got relocated to Asia. We first moved to Taipei, Taiwan, and then later to Bangkok, Thailand. When we were in Taipei, 2 of my 3 daughters were born. At the same time, I ran the American School Swim program. I was an avid swimmer, still am today, and I wanted to pass that love of the sport on to young kids, so I was running the program. I also became a tour guide at the National Palace Museum, which is the largest museum in the world for Chinese history and culture. It was fascinating. I learned a lot about Chinese history that I never knew about, right from the Bronze Age to current day time. And I got to pass that information on to English visitors. We moved to Bangkok, and we were there for about another 4 years, and then we relocated back to the US, where my husband's headquarters was in Ohio. When we came back to Ohio, I now had 3 girls, and I knew I didn't want to work full-time. They were still young, and I didn't want to work in a corporate position. So I decided to go back to school and get my master's in education. My goal was to develop educational programs online for health insurance companies or pharmaceutical companies. However, I did end up meeting somebody who was in the health insurance marketplace, and they wanted to know if I'd be interested in selling health insurance to individuals, families, and small business owners under the age of 65. So I thought, oh, great, perfect. I could work for myself. I don't work for anybody. I can get appointed with many different carriers. I can educate families and business owners how to protect their assets from medical events that happen and prevent financial ruin. So I started doing that. I loved it. I developed good relationships with my clients, but what happened is a lot of my clients started to age up, turning 65, and therefore they're moving into the Medicare market. Initially, I was referring those clients out, but after a while, I decided, no, I had good relationship with my clients. I wanted to continue those relationships and be their advocate. So I decided to also get my certifications on licenses in the senior marketplace. And I've been doing health insurance 2010 and been doing Medicare since 2013. I love what I do. As you can see all the way through this video, it's all about education, helping others understand options. I find that very rewarding, very satisfying. As I mentioned, I have 3 daughters. My oldest is Jade. She's now graduated and working full-time. Royanne is my middle daughter. She's 21 or will be 21 in September. She goes to the Kansas State University. And my youngest daughter, Shannon, she is sophomore at KU or Kansas University. Just to let you know, there is no rivalry between Royanne and Shannon, even though they go K-State and K University. Royanne doesn't like sports very much. At home, I have 2 cats, and my baby is Cooper. He's a Bernese Mountain Dog. He's about a year and a half. He keeps me company, and he lays at my feet. My husband does a lot of traveling. He's still in the energy power production marketplace. In terms of hobbies, I teach yoga. A couple of years back, I introduced my youngest daughter to yoga. She loved it, and she decided she wanted to teach at university. So she wanted to know if I wanted to do the teacher training program, so I agreed. So last year, Shannon and I did the 200-hour teaching program. So now I'm teaching yoga, a few classes a week. And my other hobby is my husband and I love to travel. And with this type of job that I do with Medicare, a lot of what I do is over the phone because I am licensed in about 21 states, although my home state is Kansas. I do a lot of selling over the phone. So hopefully that gives you a brief introduction about who I am, gives you a little bit of a feel, and would love to have a conversation with you. My office number is 800-979-0266, and appreciate an opportunity to speak with you and see if I might be able to help you. Thank you, and have an awesome day.